The Biden administration recently changed the federal definition of sex to include gender identity in healthcare. In response, the state of Florida and the Catholic Medical Association sued the Department of Health and Human Services for requiring them to perform cross-sex procedures. NTD's Daniel Monahan spoke with a legal firm representing the Catholic Medical Association about the case.
Florida Attorney General Ashley Moody says that Florida passed a law to protect children from what she calls dangerous, irreversible gender transition drugs and surgeries. According to Moody, the Biden administration's changing of the federal definition of sex to include gender identity is an attempt to circumvent that law and to force the state to pay for puberty blockers and gender transition surgery for children. Alliance Defending Freedom attorney Julie Blake.
So what the Biden administration is saying is that if a doctor gives out prescriptions for precocious puberty, that same doctor would have to use puberty blockers to transition a child in an attempt to look like the opposite sex. If a doctor does a mastectomy to treat a patient for breast cancer, the Biden administration would force that same doctor to do a mastectomy on healthy tissue in order to have a woman appear more as the opposite sex.
Blake says doctors are there to heal patients and shouldn't be required to harm them.
Every doctor should be free to follow their sound medical judgment and apply their best medical judgment to help heal patients. No doctor should be forced to block a child's puberty or to administer dangerous procedures that can have very serious lifelong consequences. And so what we're asking for in this case is for the Biden administration's rule to be completely stopped to protect all doctors and all patients nationwide.
The attorney says the new rule also seeks to require doctors to treat every patient however the patient identifies, even if that is contrary to the patient's biological sex.
Our doctors don't want to harm patients. Our doctors don't want to lie to patients or mislead patients. Sex matters in medicine. If you start referring to a patient by the wrong sex, you're risking medical mistakes, and you're also giving a patient an incorrect understanding of medicine. And so it's very important that doctors' free speech rights are protected and that doctors aren't coerced to use a patient's self-selected pronouns.
According to Blake, the Biden administration has no evidence underlying this rule to coerce doctors to potentially harm their patients.
To the contrary, respected international voices in other countries, such as England and Sweden, have realized the harms of these procedures and that there is very little, very low quality evidence to suggest that you should try and perform a so-called gender transition on anyone, especially not on children.
The attorney says the Biden administration is threatening doctors, insurers, and hospitals with steep penalties if they don't comply with this new rule, which she says puts their livelihoods at risk. NTD reached out to the Department of Health and Human Services about the case and the rule change. We are still waiting to hear back from them. Daniel Monahan, NTD News.